Today's cardinal lesson is about Medicare and Medicare in 2023. So if you're coming up on Medicare and you haven't signed up for it yet, and you're wondering what you need to do, whether you need to sign up for Part A, Part B, whether you're going to be facing penalties, all the difficulties around getting Medicare first, we're going to go over that in the beginning of the video. And for those of you that are already on Medicare, you're going to just stick around for a couple minutes here, and we're going to get into the basics of Medicare. I think you're going to learn something in this video. So what we're doing differently this year is I've brought in two books that you might be familiar with. You may have already seen them. If you're on Medicare or approaching Medicare, the government mails you this booklet. And in fact, I got this one from a friend of mine. It just comes in the mail, and it's 130 pages long, and it's titled Medicare and You. And most people that come into us, they've seen this booklet, they've tried to read it, and it is part of the reason that perhaps they've gotten as confused as they are. And then the second booklet that we're going to be using is called Choosing a Medigap Policy, a Guide to Health Insurance for People with Medicare. And so we're not going to go through all the pages and all these books, but we're going to be using this in the show notes to back up everything that we're saying. Okay, so we've pulled out certain pages, and perhaps if we can go to Tom in the show notes, we can show you that.
Yeah, and so for people new to our site, we have show notes and a link below the video directly to our website, but it has some documentation to support what's on the board and kind of what's in this video here. And so we're going to flip through here. We have the picture of these two books, the ones that Hans was talking about, the Medicare and You and the Medigap, the guide to choosing a Medigap policy there. And so we'll get into the specifics. And again, the show notes, we've pulled out some of the important pages. The full book is on our website, but we'll start flipping through here. And I think the initial thing that Hans and I want to go over is for these people just turning 65, they're coming up on the time where they know they need to make a decision. And it's really around, should I sign up for Medicare or not? And so, Hans, if you want to talk a little bit about the different enrollment periods and kind of what decisions people have to make.
So the next 7 pages in the show notes come out of this book, the Medicare and You book, and they deal with you folks that aren't on Medicare yet, but you're facing signing up for it. And you're at a decision, should I sign up or should I delay? And then what about those penalties? And I'm going to try to make this simple without delaying this whole video of going through all the documents. So if Tom, if you can just pan through some of those pages, and I can show you where it's going to back up everything that I'm telling you. And if you are not working or you're retiring right at 65 and you don't have group insurance and a group coming from an employer larger than 20 employees, either you or your spouse, so you need Medicare anyhow, you're going to want to sign up for it, Part A and Part B.
I do want to make the point too on that note. And so we often will get people asking the question is, oh, I have health insurance from my employer, but I retired a couple of years ago. Retiree coverage does not count to being able to avoid signing up for Medicare when you're 65. Some other common ones that don't qualify are marketplace plans, Obamacare plans. That does not qualify for you to delay Medicare. COBRA doesn't count either. If you're at the VA getting coverage there, that doesn't avoid the penalties for Part B. So this is really, you are working or a spouse is working for an employer, currently working, that has more than 20 employees, and you have health insurance from that employer.
So if that's your situation and you're satisfied with your health insurance, you're free to delay Medicare. So that you can say, I'm not taking it at 65. You don't really have to tell anybody anything, because when you're going to be telling Medicare something is when you ultimately want it at 67 or 68. So for those people working beyond 65, which is a lot of people these days, or for your spouse is working beyond 65, or they're under 60, whatever, is if you're reaching eligibility for Medicare, you get a free pass on the penalties for late sign up by proving to Medicare that you've had what is creditable coverage. Okay. So if you're satisfied with your group, you're covered, you're kind of good to go, you can just delay, and you're going to do the proving business to get out of the penalties when you ultimately sign up for Medicare.
And
Now,
those people that delay, once you sign up eventually, you're going to use that special enrollment period that's in the show notes here. And again, you can find that, print out the show notes and look at them. But you have an 8-month window once you leave your group coverage to sign up for Medicare, and that avoids all penalties. And so we've gone over this in a lot of videos, and we still get a lot of questions about it. If you're covered by an employer with more than 20 employees, you do not need to worry about any Medicare penalties. If you're not, you do need to sign up when you first are eligible at 65.
okay, so now the add-on to that is if you're covered by group insurance, you don't need to sign up for any part of Medicare, but you can sign up for Part A only, and skip Part B. And you've got no out-of-pocket premium for Part A. So people say, well, why wouldn't I? Well, you can sign up for Part A only, keep your group insurance. You don't have to pay a premium to Medicare and get B later. And then there's one exception to that, is if you're covered under a health savings account and you sign up for Part A, you're going to get some problems with that. And I don't really want to get down into the weeds, into the details too much about that. If you have questions about this business, just give us a call or get on our website or send us an email, and we can clear it up pretty quickly for you what you need to do. And now I want to move on to the meat of the video, is around the decisions for you people turning 65. That you're next is really the second decision. And then I also want to talk about for you people that are already on Medicare, I want to clear up some things for you. So Tom, you want to talk a little bit about this page right here?
Yeah, so what we have on this page, and this is really the meat of the board that we're going to look at here in a second that Hans is standing next to, is when you have made that decision, okay, I do need to sign up for Medicare. I'm not covered under the group coverage. Now there's a second decision you have to make is am I going to stay on original Medicare, or am I going to go to a Medicare Advantage plan? And those are different options. It's a binary choice. It's one or the other. You can't have both. And what a Medicare Advantage plan is you are electing to kind of have Medicare outsource your Medicare coverage to a private insurance company. So you are telling Medicare, I want to go to this private insurance company, and Medicare offloads you from their coverage over to an individual company.
Okay, so what I want to point out, and if you look on that page and you look on our board, there's this thick line here that's in the middle. And the point I want to make is you're either here or here, not both places. So you're either on original Medicare, Part A and Part B, you've purchased a separate Part D drug plan, and then you've purchased, which most people do, a Medicare supplement policy to go along with that. And so you're getting your Medicare from the government, you're getting your Part D of Medicare from the government, and then from a private insurance company, you're buying a supplement to cover it. It's all over there. Now, if you go the Medicare Advantage route, what you're doing is you're taking your Part A and your Part B of Medicare, and by your election, you're allowing the government to outsource your insurance coverage, Medicare, to a private insurance company. Okay, so what you're doing is you're saying, okay, I've looked through all these potential insurance companies that have these approved Medicare Advantage plans. And what I want to do is I want to turn my Part A and Part B into a Part C Medicare Advantage plan. And I'm now going to get my Medicare benefits from a private insurance company like Humana or United Healthcare or Aetna or Cigna or one of a whole list of those companies. But it's real clear. Once you go over here and you have all this, you're not over here anymore. Now that sounds pretty simple, but we have people who've been on Medicare for years that come into us quoting rules, things they're worried about. They're over here, but they're assigning attributes that apply to this side to their situation. And then likewise, we have people that are on a Medicare Advantage plan. They already did this a few years ago, but they're taking attributes of this. They're calling this a supplement. They're doing a number of things. So this is a big point of confusion in this whole deal that we're talking about, which is Medicare and supplemental insurance, or Medicare turned into Medicare Advantage, is people about this fundamental thing are unclear. And then they go forward and they understand little bits and pieces. They just haven't put it in the right place of the puzzle. So everybody starts by signing up on original Medicare Part A and Part B. And then some people immediately turn that into a Part C, and then they're over here on this part of the board. So what I want to do is I want to go back to Tom, and we want to start into helping you make the decision of whether you're going to be on that side of the board or this side of the board.
Yeah. And so I think that's a very good point. And that's why we've drawn this line in the middle of this page is it's an either or. You're either on one or the other. The next set of pages, the next 2 pages really in the show notes, really kind of go through and give you a pretty good summary of the differences between original Medicare and a Medicare Advantage plan. And so, we can go through a little bit, but I want to point out the biggest reason why, the biggest advantage of a Medicare Advantage plan is this one about halfway down the page where it says you might have you also have to pay the plan's premium, but some plans have a zero premium. There are a lot of areas in the country, and this is mostly, if we're on a Medicare Advantage, mostly what we sell are plans that cost $0 a month, which is really nice compared to a supplement, which it does have a premium that we'll go over in a little bit. And so the biggest advantage of an Advantage plan is the lower cost, is it's just less costly per month. On the next page, it talks about some of these extra benefits that are in here. So a lot of the Advantage plans will include things like dental, vision coverage. They might cover the gym membership. But we see this happen all the time is people will make the choice to go with a Medicare Advantage plan for those extra benefits. That's the main reason they're doing it. When really that should be considered an added benefit as opposed to the main reason we're doing it, because you're buying the health insurance for if you get sick. And if you're solely making the decision based off of the extra benefits, you might be missing the boat on if something were to happen to you from a health standpoint. If we switch over to the original Medicare side, what is the biggest advantage of that? Is the biggest advantage is there are no networks with original Medicare and a Medicare supplement. You can see that up here at the top is you can go to any doctor or hospital that takes Medicare across the country. If you live in North Carolina, you could be traveling to California, New York, Florida, doesn't matter. If the doctor takes Medicare, they take your supplement, no questions asked. That is a really big benefit because if something happens health-wise, let's say you get diagnosed with some rare condition, you have the choice to go see maybe the specialist. That could be at the Mayo Clinic, or they could be somewhere that, down in Texas, wherever it might be, you could see them and not have to worry about having coverage there.
So if you go through this comparison, and one thing that I like about in the show notes is this is from Medicare, the CMS. I mean, the Centers for Medicare Services, they've made a 2-page comparison in bullet point form of the left side of the board and the right side of the board. And you hear a lot of people talking about this, which one is better? And I say neither one is better. They're just different. And you have to make a decision which one you're going to take. So this is the government giving you the information to do that. So you're going to want to get a hold of it. And if you are not familiar with this book or you haven't seen it, you can go to our website and download it. Same with this book. So you can get both of these books at our website under the Medicare Worry. You also can just go, like I did, to do the show notes is you can just find it in Google and download it from there. So these books are readily available. I think this is really cool. And it really just boils down to, this is not managed care. This is Medicare and private insurance. And your private insurance company has nothing to do with the delivery of your health care. All they simply do is plug in the gaps of Medicare. This is managed care. It's either a PPO or an HMO or one of the other various forms. But these people are managing your care. You got to go to their doctors and their hospitals. Doesn't mean it's terrible. I mean, a lot of you are on managed care. You've been on it your whole life. And now with your Medicare, you're going to elect to stay on it. And the biggest advantage you're going to get from that is you're not going to have to pay a premium if you can get into one of these zero premium plans. And then secondly, you are going to get some extra benefits like dental, vision, hearing, a thrown in Part D plan. So this can be economical in terms of the premium payments. This can be economical in terms of if you get really sick, you're going to be really pleased with how this works out. And then secondly, the real issue, it's actually firstly, is the real issue is the managed care business. So let's move on and let's talk about the next point, which is this Medicare supplement Medigap insurance. So a lot of people say, oh, I'm in, I want to get a Medigap, and then they just sign up for one that comes along, and there's still some more to do here. I mean, you still got two more sets of decisions.
Yeah. And so now we're really switching. If we're looking at those two books, we're kind of switching over to that guide to buying a Medigap policy, that second book that really talks about what your options are there. And so these next several pages will be pulled from that book. One point that we want to make, and this is something that a lot of people, even people who have been on Medicare for many years, they just still don't understand this point, is that Medicare supplements are standardized. And so back several years ago, the government said, we need to make this easier for the consumer to compare one supplement to another. And Hans can speak to this in a second, but it used to be these companies would coming out and just, I have the best supplement compared to this next company. I add this bell and whistle. This makes it a better deal. And so the government said none of that. We're going to standardize this. We're going to make them, they give them all letters and say a G plan or an F plan is the same. It's identical from company to company. There is literally no difference from one G plan to another. The coverage is the same, but the price can be very different. And so once you've made the decision to go that route, to go the Medicare supplement route, the next choice is really which letter supplement do I want? And then we'll get to this in a little bit, is then after you've made that choice, then we can start comparing company to company. But the most common plan that we're selling is a G plan for people newly coming onto Medicare. I will say there's really, on this chart, most of these plans are pretty much irrelevant. There's three main ones that are sold across the country: an F plan, a G plan, and an N plan. F plan can only be bought for people who are on Medicare prior to January 1st of 2020. So if you're new to Medicare in 2023, the G plan is the most comprehensive plan you could purchase.
Yeah, and that's where the reason we have it highlighted and we're reviewing it is, once you go this route, you might as well go with the best. And we're going to show you how you can shop for this stuff from a whole list of companies. And you can even do that right here with us at Cardinal. We're in all 50 states and the District of Columbia, or you can do it locally. But you can pick from a whole list of companies and buy one of the lesser expensive ones coming from a good company. It allows you might as well buy the best. And that's the G for the people that are available for right now. And people older than that, if you're on Medicare supplements or you're on one of these Advantage plans, you're watching this video and you're thinking, well, I want to go back and rethink these decisions. If you came on Medicare before 2020, you can still buy an F plan. You might want to consider that. We could compare the two. But for the purposes of this video, we're going to use the G as the standard. And I want to make a point that a G from Mutual of Omaha is identical to a G from United Healthcare is identical to a plan G from Humana, and so on and so forth. So they're all exactly the same. The government did that, so at least when you're comparing companies, you know you're comparing exactly the same thing.
And then you can see on this chart in the show notes what the G plan covers is the list down the left side are all the things that original Medicare does not cover by itself, Part A and Part B. And so these would be gaps. These would be things you would have to pay for otherwise out of pocket. You can see the G plan covers 100% of all these things except for the Part B deductible, which is this line here. For next year, for 2023, the Part B deductible is going down to $226 a year. After you have paid that deductible, anything that's covered by Medicare will be paid 100% with original Medicare and the supplement, and you'll be have very little out-of-pocket costs, which is really nice. Especially if you've had some health concerns. We have a lot of clients, and we'll get to this in a second, but we have a lot of people that come in, they might have cancer or a new diagnosis of something really serious, and they're turning 65, they sign up for a supplement, they go that route because they know they're going to have medical expense in the future, and it's just really great coverage.
Okay, so next slide.
And so the next page is really talking about the open enrollment. And so this is when you are first signed up for Medicare, it's driven by the effective date of your Part B, is you have a 6-month window where you can sign up for any supplement you want with no health questions. And so this is to that point I was just making, is you could have some serious things going on right now and sign up, and they can't turn you away. They can't say, no, we're not going to take you. They cover those conditions. The next page talks about pre-existing conditions, is you don't have to worry about those if you're signing up during your open enrollment period. And then the other thing, then this is made, the point is made in that Medigap guide, is that I'll just read it to you. There can be big differences in the premiums that different insurance companies charge for exactly the same coverage. And so that's to that
Okay,
point.
so grab onto that. Exactly the same thing. And it just goes back to my point. A Plan G is a Plan G is a Plan G, and it says it right here in the book.
Yeah, which is just, it makes it very easy to compare one company to the next. So now, any other points you want to make, Hans, before we jump into the?
No, let's just jump into the prices. I mean, I put these together this morning, and I ran 5 major companies that are available in most states. I think New York is missing one of them. And I did these in New York, California, Texas, Florida, and North Carolina. And they're different in all 50 states, but I just tried to give you a range of prices and just give you an idea of what you're looking at to buy a Plan G Medicare supplement and the choices that you're going to have.
Yeah, and so we're going to flip through pretty quickly. There are more options than this, but we wanted to give you the price of some of the larger companies in this market to show you how it's different, how these companies can charge different prices, but it can also differ from state to state. So this first one, we ran it as a 65-year-old male who is single. And so some of these companies, you'll see these rates here. It says HH discount, that's household discount. Some of these companies will give you a discount if you're married or if both spouses sign up. So call us and we can help figure out which one's which. But right now, we're going to look at a single male who is 65, just coming onto Medicare. So Aetna in North Carolina is $117. United Healthcare is $121. Cigna is $126. And Mutual of Omaha is $126, similar price. And then Humana is $131. So that's sort of that range of those companies. We're going to flip through pretty quickly here just to show you the order can be different from state to state. So the next state we're going to look at here is in Florida. You know, the order is United Healthcare, Mutual of Omaha, Cigna, Humana, Aetna. And then you can see the prices are much higher. It's $188 for United Healthcare in Florida. In Texas, the prices are a little lower than Florida. It's $134 for Mutual of Omaha. Aetna is $137. United Healthcare, $139. You can sort of see that there. And then we'll flip over to California. Again, you can see the order of these companies are changing from state to state. The prices are changing from state to state. But this is the same G plan across all of these states and all of these companies. The coverage is the same. And then New York is the last one we'll look at. The prices are a lot higher in New York. You can see, you know, United Healthcare being the least expensive at $278. And so, I mean, it's a pretty big difference where you are located. And again, that's only 5 states or so that we looked at. You might be in a different state. I'm going to show you real quick how you can actually run this quote yourself. We have this on our website. I would not recommend going and Googling Medicare supplement pricing, and you'll get all these ads and stuff. Say, put your information in, we'll give you a quote. And then they kind of lead you along as they say, okay, give us your name, you type it in, give us your email, what's your age, what's the phone number, and you hit go thinking you're going to get a price. And they say, okay, someone will reach out to you. And then your phone blows up with a bunch of phone calls. So we have a spot on our site where you can run this. You don't have to give us any of your information, and just see what the price would be for yourself here. So we're going to switch over. Our website is cardinalguide.com. Once you're there at the top, there's the 7 worries section. If you click on that and hit Medicare, that will take you to the Medicare site. And right at the top of the page, there's this section that says start free comparison. I'm just going to do this really quickly in North Carolina here just to show you how it works. So you type in your zip code, put in your age, your gender, and whether you use tobacco products or not, and then hit run comparison. And what it will do is it will run the prices of all the companies. And so this list will look a lot longer than our show notes because we're going to have all of them that show up on the list here. And so Signet 100, and then I'll just kind of scroll down here, is you can see that the pricing, you can see all results actually. And it goes down. I will show you like the most expensive here. And some of these are rated companies, but for example, Guaranteed Trust Life, 175 for the same G plan. I mean, it can be a big difference, and it's worth shopping this to make sure you're getting the best price.
Well, the point here is I want you to be able to go on there, run your prices, shop for this stuff, and you don't have to worry about us taking your phone number and your email address and selling it to everybody in the world, because that's even worse than what Tom, a lot of times when you're going and Googling that and you're on a website, you're not even with an insurance company or an insurance agent, you're with a lead company, and you're giving them your zip code and your email address and your phone number and your name and that you're 65 years old. And then that lead company sells it to all these insurance companies and insurance agencies. And literally your phone blows up. We're not going to do that to you. If you ultimately call us, we're not going to call you repeatedly. I mean, we're just going to be there to serve you. And you can go in and run these rates on these things by yourself. You don't have to tell us anything. So go to cardinalguide.com, go to Medicare, and then scroll down the page, and there's that rate calculator, and you can shop this stuff with your zip code all by yourself. So I wanted to add really the last section as a point is that a lot of people think that age 65 is when Social Security starts. And it used to be that way, like 40, 50 years ago. Like when my dad retired, age 65 is when you got your full Social Security amount. You could still get it at 62, but you would get less. So then the reason we're talking about this on a Medicare video is you sign up for Medicare at Social Security. I mean, you go to the SSA.gov and you enroll in Medicare. And if you're already on Social Security, you don't need to sign up for Medicare. They're just going to mail you a card. But you don't have to sign up for Social Security to get Medicare. You can just continue delaying your Medicare. In fact, if you're still working, or even if you're not working, many folks choose to delay their starting of Social Security. And what I'm going to show you is why. Is because what used to be 65, full retirement age, is on its way to age 67. So if you were born in 1960 or after, your full retirement age is 67. So that's when you're going to get your full retirement Social Security check. And anything short of that is early retirement. But for you folks turning 65 in 2023, you were born in 1958. Like me, that was a vintage year. That's when I was born. Age 66 and 8 months is the time that you're going to, that is actually going to be your full retirement age. Now, I'm not suggesting you wait till then. I'm also not suggesting that you sign up then, because some of you are going to wait till you're 70. I'm just simply telling you what your full retirement age is. If you're born in 1958, for getting your Social Security check at 66 and 8 months, 1959 at 66 and 10 months, and people 1960 and after it's age 67. So with that, I want to close this thing out by showing you up and down the left side and the right side are the 7 worries that we cover. They're in my book. They're in the whole video series. And each one of those subjects we address in these videos. And what I want to do today is I want to show which of these did we address in this video. Well, we addressed Social Security, we addressed Medicare, and we really didn't talk about the other 5. So with that, I'm Hans Scheil, and I thank you very much for listening.
Thank you.